Hello and welcome to the Patient Procedures portal. Patients often turn to ungoverned YouTube clips for visual guidance on how to self-care. The benefits of video content are well reported. In response to patient demand for clear, evidence-based teaching, we have created this platform. We asked patients and clinicians where the gaps were in the discharge pathway. Our films are designed to be used at home following discharge to remind patients how to perform the procedure. Here is our show reel, consisting of one full procedure followed by short clips of several others. This is a short taster of our portal.
This film was designed as a refresher on the training you've been given on changing your nephrostomy dressing and bags. If you'd like further training, if we're unsure about anything, please contact your healthcare provider. This film has been created using a model with a nephrostomy tube taped in place. Prepare your equipment. Assist the patient onto a chair, sitting in an upright position with their back exposed. If your patient is unable to sit up, assist them to lie on their side with their back towards you. Wash hands using soap and water or alcohol-based hand rub. For top tips on effective hand washing, please look out for our Handy Hints film in this series. Keeping the drain secure with one hand, carefully remove the existing drain fixation dressing and inspect the incision site. Check that the suture remains intact. Pour a small amount of adhesive remover onto a gauze swab. Keeping the drain secure with one hand, use the adhesive remover to remove any residue from the drain tubing itself. Decontaminate hands. Clean the drain site with sterile tap water, working from the drain site outwards. Gently remove any incrustation and allow the site to dry. When the site is dry, apply a sterile drain fixation dressing according to the manufacturer's instructions. For example, a drain fix dressing. Decontaminate hands with alcohol gel. Disconnect the drainage bag from the nephrostomy tube. Clean the connector hub with an alcohol wipe. Apply a new sterile drainage bag to the nephrostomy tube, being careful not to touch the hub. Urine should begin to flow. Secure bag to patient with waist strap according to the patient's preference. Be careful to ensure that the tube is not taut nor pulling at the exit site. Dispose of waste in a small waste bag and check with your local authority about waste arrangements. You should contact the hospital or your community team if any of the following things happen. You develop signs of infection, the nephrostomy tube falls out, the nephrostomy tube stops draining, or if the nephrostomy tube leaks.
Disconnect your catheter from your thigh strap. Open the packet containing the valve, being careful not to touch the contents. Clean around the catheter connection with an alcohol wipe. Twist and pull to disconnect your current attachment. This could be a drainage bag or a valve. Stabilise the catheter in your non-dominant hand throughout. While holding the catheter in your non-dominant hand, attach the new catheter valve by pushing the funneled end of the valve into the open end of the catheter. This completes the valve attachment. To drain urine. While holding the catheter in your non-dominant hand, drain your bladder by flipping the lever on the catheter valve in a downwards direction using moderate pressure. Drain your urine directly into the toilet. When your bladder is empty, return the lever of the catheter valve into the upwards position whilst continuing to stabilise the catheter with your non-dominant hand. Resecure your catheter on your thigh using your thigh strap. Dispose of all your equipment in a small waste bag and check with your local authority about removal. Wash hands.
This film is designed as a top tips and handy hints guide to effective hand washing. Wash those germs away, keep infection at bay before you perform your clinical procedure. Turn on the taps and, where possible, direct the water flow away from the plug hole. Run the water flow at a rate that prevents splashing. Run the water to a comfortable temperature. Wet your hands and wrists. Apply liquid soap and water to all of the surfaces of your hands and wrists. Use enough soap for a good lather. 1 or 2 pumps is often enough depending on the size of your hands. Rub hands together for a minimum of 15 to 30 seconds.
Seal off the bottle by closing both sliding clamps on the drainage tubing leading from the patient and the bottle connector. Clean the end of the tubing with an alcohol wipe. Wait a few seconds and then securely screw the new sterile bottle into the connecting tube at the lure lock. Unclamp both sliding clamps on the drain tubing. Suction is established if the concertina bung remains compressed. Check the vacuum on the drain periodically. The concertina bung on the drain should remain compressed for effective vacuum. If this is decompressed, you will need to change the bottle and check the connections. If changing the bottle doesn't resolve the problem, please contact your surgical team. The patient should look at the stoma, if necessary with the aid of a mirror. The patient should wipe away any mucus with gauze soaked in warm water and gently pat dry. Your specialist nurse will have recommended a catheter type for you. Holding the catheter in your dominant hand, place your other hand with 2 fingers either side of the stoma. Ensure the drainage end of the catheter is over the toilet bowl. Insert the catheter gently into the stoma, following the pathway inside, usually towards the middle of the abdomen. Until urine starts to flow, then insert the tube a further 4 to 6 centimetres.
I found the videos extremely helpful and informative. It would have been no end to me have help to me after my operation. You get so much verbal information in a short time that it's really quite difficult to remember and take it all in. So being able to play it back a number of times with a great deal of detail included would be helpful.